constipation is a huge problem these days, and unless it's for a few days because you were sick and you took antibiotics or perhaps or whatever medication is causing it, it is absolutely a dysfunction of your body parts, your intestine, as a result of something that's happening right inside your pelvis. So constipation and pelvic floor dysfunction, in the absence of it being as a result of side effect of medication or your improper diet, go hand in hand. So one of the things that I get a lot of inquiries about is, well, the individual has had constipation for a long time and it just seems like nothing is working. Now, when they're referred for pelvic floor dysfunction treatment, most often what happens is the issue is approached through the anus or through the vagina, and with the hopes that we can go in. It's actually on the anus part, I should say. Sometimes it's from the vaginal area as well, just depending on what else is being discovered as the digital examination and insertion through the anus takes place. But essentially, we're going inside the pelvis and we're trying to work on the very muscle called puborectalis, which is a muscle of the pelvic floor that is basically blocking the intestine, and it's not letting go for the fecal material to go down the intestine and out the anus. The issue that I have with this approach is, while it may help the individual, shouldn't we ask why it's tight? And from my perspective and what I see in my practice, I can tell you that the muscles inside your pelvis cannot just stay tight, because in the process of some of these muscles being tight, some of them are weak, and frankly, a tight muscle does not make that muscle strong either. It becomes weak as a result of overcontraction. So the approach that makes sense to me is chasing after the why, to see why that muscle or those muscles are impacted. And the answer always comes, from my perspective, to pelvic instability. When your pelvis is unstable, the whole agenda for the brain and for the sake of your safety is to try to stabilize it. And one thing that I always tell my patients is, listen, without your upper and lower extremities, you can still survive. But without your trunk, that's impossible. So your pelvis is the base of this structure, and its stability is crucial for the functionality and stability of your trunk. Your trunk is that part of your body that is covered by the one-piece bathing suit, if the bathing suit was like sleeveless instead of having the straps. So that whole area covers, that the one-piece bathing suit covers, is your trunk, and the pelvis stability impacts what the positioning of the rest of it is going to be. So in an attempt to stabilize this pelvis as much as we can, the inside muscles have to respond to the outside muscles to stabilize this. This is a double layer wall. Inside and outside work together in an attempt to stabilize it better. This area not only has the spine connected to it, and its dysfunctional presentations impacts the stability of it, but also the legs are connected to it. So any lack of performance in the lower extremities, any imbalance from right to left, will create issues with the stability of this. Therefore, your body is going to borrow whatever muscles it can to try to minimize that amount of pull and yank. So one thing that highly, I don't know if I'm going to call it frustrates me, but it does, is the fact that we're approaching it, in my opinion, the wrong way. We need to stabilize the house in an attempt to take care of a dysfunction of the floor of the house. Puborectalis, it belongs to the floor of the house, and the floor of the house is not living by itself. It is intertwined with the walls on the inside and directly responds to the outside. So in my opinion, when someone talks about chronic constipation, I start asking them questions about their back, their hip mobility. It's not necessarily pain. Knee issues, ankle and feet issues, sacroiliac, that's this part of your spine where your sacrum is connected to your ilium right and left, this joint, and the spine. We're not talking about pain here. We need to stop thinking in terms of presence or absence of pain, because there is so much that happens before the pain. If you have poor posture, you definitely have instability in the pelvis, and that instability down the road can show up as constipation and so many other presentations of pelvic floor dysfunction. So I just wanted to do a video on that. I know this is a very sought after subject, and from someone who is trained in the field of pelvic floor therapy, I can tell you that I never go on the inside to address what is typically done in the world of pelvic floor therapy. I'm after stability of the pelvis and the rest of your body in functionality, and the problem solves itself. Your body parts are dying to show you what they're capable of. If you provide the environment for them to show off what they're capable of, they are dying to show it to you. So think through the pile of information that's provided to you and start thinking in terms of, does this information make sense or not? Instead of following what is being done by so many people. And of course, there are going to be people who are going to be helped with. But how long does the result last is what we should be looking at further. I hope you enjoyed this. I hope you have subscribed to the channel, and I hope you look into your chronic constipation, because there is more than not being able to go to the bathroom that comes with chronic constipation. Thanks for watching.